Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that dial. This is a very important show. You know, what's more important than your health? Okay? What do they say? An informed nation is a peaceful and healthy nation. So we're going to talk about your health. And we have one of the top shelf guys here. I should guy. He's my buddy here, so I can say guy. He's a doctor, you know. And his name, believe me, is Glenn Miller, Dr. Glenn Miller. But he didn't bring the orchestra and the violins and everything with him. But we're going to talk about it. But before I do that, I want to thank Brian Tolerance, right? I think that's how I pronounce it. But he's director of marketing from communications at Mercy Suburban. You know, and we worked hard. It's hard to get doctors and lawyers and judges on my show because of cancellations and all. But we're here, okay? This is next to the last show for my 23 years on the show. And I have one more show for the summer. Then I'll be back in September. But my guest today, he is the chairman of the Family Medicine. He's chairman, yeah, that's right, of Mercy Suburban. Okay, I want to get that right, all right? But here he is, a good-looking guy, isn't he? Oh, my God. You look like a movie actor, right? So, Doctor, you know, you're with Mercy Suburban.
Correct.
And I know that there's been a lot of changes, not changes, but additions, okay? And my heart is right with Suburban because way back, over 50 years ago, maybe 50, when there was Riverview Hospital on Sandy Street,
Right.
my first daughter, right, Joanne, was born there. And the hospital was so crowded, she had to wait in the hallway until they could deliver the baby and all, you know.
Sure.
So everybody was really busy, you know. And then they moved to East Norton and became Suburban. Now it's Mercy Suburban. So, all right, now I want you to tell these people. I'm going to be like, I'm a former policeman. I'm going to interrogate you, okay? I want some questions. I'm going to give you some questions. I want some answers, and I'm sure it's all for you, ladies and gentlemen. We're getting, doctors don't make home visits, but we're coming into your home, and we're going to tell you some of the things that could be helpful to you and what we have around, what's available for you. So let's start. Give us a general idea of what's going on over here at the Suburban Hospital in East Norton.
Sure. Well, Mercy Suburban, you know, we're an acute care hospital with 126 beds. So we take care of just about everything, heart attacks, pneumonias, things like that. And we're adding some services over the past couple years and into the future. We're building a new cancer center, which is an $8 million project. It's going to be about 12,000 square feet. We'll have in there new chemotherapy rooms, and we'll have genetic counseling, the latest equipment, radiation, which is what's called, Hank, a linear accelerator, which will be...
What's that for cancer?
Well, it's for cancer treatment, for radiation treatment of cancer.
Yeah.
And it's more focused than some of the older types, so it doesn't damage good tissue. It just tries to focus on the good tissue.
I can vouch on that because I had prostate cancer and colon cancer.
Correct, right.
With the colon cancer, they give me with the needle, what do you call it? The
Chemotherapy.
Right. Chemo? No. The other stuff they give, the injection, whatever. And then when I got prostate cancer, then they put the radiation.
They do the radiation, yeah.
And then that, they didn't have the latest, I don't want to mention the hospital or anything, but they didn't have the latest machine, okay? He said because it would damage around the other areas. But then they come in with this other machine that, IMRTC or something like that?
Right.
What's the name of it? I don't know, whatever.
IMR, I believe. I'm not.
Yeah. So what happened, now you have the latest thing.
Yes.
The latest thing.
Yeah,
So
so-
it just zeroes right in with the cancer. It don't damage the other parts,
Exactly,
right?
exactly.
So
We also have a new bariatric surgeon that's come to town.
what's that?
Well, weight loss surgery, the lap band, those types of things you've heard about, where they resect part of the stomach and it can help you lose weight. Now,
Oh, my God.
for family medicine, that's really important because we see a lot of patients.
You're a family doctor,
I'm a
right?
family doctor.
Right.
So I see a lot of people with diabetes, and of course, the beginning is
Well, I
exercise.
got diabetes. Tell me about it. What do you got to help out?
Well, the first thing is to exercise and lose weight. Follow a good diet. And
I got a little bit of buns. I like spaghetti, you know?
Yeah, right. Well, and we do have diabetes teaching classes, so
Uh-huh.
so we want to educate the patient first. Then we have medications.
Well, when you teach, can people come here and make an appointment?
Oh, absolutely. We have classes.
Is there a fee for that, or how
yes, there is a fee, but I think it's modest. I don't
but
think
it's part of the program.
Part of the program, yes.
Right.
So that's a big help. But if a person just cannot lose weight, despite everything that we do, and they're 50, 100 pounds over weight, we now have bariatric surgery that can help them. And we see the blood sugars just come back to normal when the patient has had that surgery and they lose 50 pounds, 75 pounds, 100 pounds. So that's been a big advancement.
In other words, to lose weight.
It's to lose
Well,
weight.
the fat machine don't work. I got another thing to how you can look. If you're fat, right?
Yeah.
Just travel with skinny people, and that way
Eat
you'll
what they
look
eat.
thin, right? So how's it? I said that wrong. I don't know. Whatever it is. Okay. All right. So, all right. Now, there you have something else. You got the latest stuff. You have something that nobody has in Montgomery County. No other hospitals in the area. And what is that? It's like a.
It's the robotic surgery, the Da Vinci robot.
Hey, Mike Paisan.
Yeah, you're Paisan,
Da Vinci, right?
Yeah.
Hey, Da Vinci, painter and whatever. Okay.
So Hank, that really allows the surgeon to go in and just work through little ports that they put through the abdomen. And what happens with this is we find there's a lot less blood loss, less infection, and the recovery time is really cut down. You're in the hospital a much shorter time, back to work because of this Da Vinci instrument that we now have.
How did that come about? I mean,
Well, there's been laparoscopic surgery for quite a while now,
Yeah, in
where
other
they can
words-
put in the ports. But the Da Vinci is a specialized machine that they've made.
we have a picture of anything of that, or we had some.
We
had
should
some
have
photos.
we should have a photo of that, I believe. Yeah.
Which is one here.
That would be. Here we go. This one. That's Dr. Bruce. Dr. Bruce is the head of surgery at Suburban, and he's, of course, an expert in using that. It's usually used for colorectal problems, for gynecology problems, and also for urology.
And they don't have to rip you wide open to find out, right?
That's right, exactly.
Right.
Yeah, it's the recovery is much easier.
And they do a lot now. They do it with the gallbladder too. I understand they
Yes.
do it without ripping you all apart.
Right.
So that's
much
good.
much easier.
Yeah. Now, all right, you got another photo here. What is this? Is this the new?
That's the new cancer center.
Oh man, let me tell you. One good thing about this, you won't have to go to Hong Kong, Yokohama. You don't have to go to Philadelphia. You go right here. Right this Northtown area.
Exactly.
That's important. Everybody thinks, well, I got to go to Philadelphia. I have to go to New York. They all go to the same school, the doctors. And you got the same equipment. What's a scoop? I want to look at the report card. I don't want to look at what it is. All right, how about this? Is one of your rooms in the...
That is the sleep center where we send patients to be tested for sleep apnea and restless leg syndrome and those types of things.
Oh.
Now, Hank, you'll remember about, wasn't it Reggie White? Sleep
the
apnea
football
played a
player.
part in his death.
Huh?
I say, in Reggie White's death, sleep apnea played a part in that. He had sleep apnea. And so we think it's very important to test for this. And I've sent many patients there, and it's really a good program.
Well, what do you mean? What do they do? Like somebody can't sleep and all?
Well, you could, for insomnia, if you can't sleep, they can help that. But the sleep apnea is a condition where you're not breathing correctly during the night.
Oh, okay.
And we see it a lot in medicine because we see people with high blood pressure have it. In other words, it can be a cause of high blood pressure. You're tired all the time in the day, those types of things.
And then I think somebody's a friend of mine that when he goes to bed, he has to put something on every.
Yes.
Because he's breathing or something.
Put probably a CPAP, a mask, which will allow you to breathe throughout the night and not have that constant awakening.
And then, does that have anything to do with snoring?
Yes, it has a lot to do with snoring.
Yeah. Right. Guy got,
Right.
one time I went down to a fight down in Atlantic City, and I had to stay over at one of the casinos down there. And this guy says, well, we're going to room together. This guy snored. I never heard a snore. It sounded like I was in the battlefield or something.
Right.
Woo! I mean, I say, how did he wake up?
Yeah.
He make all that noise and he didn't wake up. He was just sleeping, but kept me awake.
Keeps you awake, but also they have short awakenings throughout the night. That's why they feel so tired the next day, because they're not really getting a deep sleep.
Yeah. In other words, if you don't get enough sleep, well, tell me. You're a family doctor. Tell me what's how for that. How I can keep myself in shape.
Well,
That's most
of
important.
course you can get tested, use CPAP and that type of thing, but losing weight has a lot to do with that too.
Yeah.
If you lose weight, many times the problem will not be as severe or may even go away.
All right.
So exercise and eating right.
Exercise. Like if I sit on a chair and I go like that with my legs and stuff like that, that's exercise.
That's exercise.
Too. You know, because I'm 88. I can't be going around.
You don't look
it. I can't be going like years ago. I did all that stuff, a police motorcycle and all that stuff. You know.
Sure.
But now I got to find different exercise standing still.
Walking is a great exercise.
Walking, yeah.
And we recommend that all the time to patients.
And make sure you keep your feet in shape. You know. That's more important too, right?
Exactly.
Right. I know my father was a shoemaker. We all worked in a shoemaker shop. And I remember my father would tell these women that were wearing high heels, that it would, eventually you'd have problems in their back because your whole body's out of shape.
Still a problem today, even.
Right. Well, yeah. But now tell me something about yourself now.
Well, I've been practicing in Conshohocken for 31 years.
Whereabouts in Conshohocken?
7th Avenue.
Oh, yeah?
7th and Fayette.
7th and Fayette. Yeah. Okay.
And I practice family medicine.
I go by there and I see Dr. Miller.
And I have a Dr. Mancini who's been with me for about 20 years.
My paisan.
Yep, your paisan. And the most exciting thing that's happened to me in a long time is that my son just joined us in practice.
Oh, he's going to be a doctor?
Miller Jr. Well, he's a doctor.
He is a doctor?
He is a doctor.
Where's he practicing?
He's practicing at my office 4 days a week. And doing a great job. He's been there about almost 2 years now.
All right, after September, we'll bring you both back.
Good.
Father and son.
Wonderful.
Yeah, I'm going to have...
We'd love to come back.
Yeah, that's good. I want people to know that the kids are following up. What happens sometimes, the sons go this way, go that way, but it's nice that they follow the father's profession, whatever it is, or, make
Hank,
him proud.
It's been the best thing that's happened to me since I've been in practice. Having him join me.
That is great, Now, you practice in Mercy Suburban.
Mercy Suburban,
right?
yes.
Okay. Now, what schools did you go to?
Well, I went to Plymouth Whitemarsh.
Oh, you're in Montgomery County.
Montgomery County.
Oh,
in fact, I played on the football team with Dr. Bontempo, who's a vascular surgeon at Montgomery.
Oh, yeah, I'm going to have him on my show here, but I couldn't get him.
And Sam Paleo, Dr. Paleo was one of my teammates.
He did my hip replacement.
Right.
I want to go down there.
Yeah, both great doctors.
Oh, yeah.
And
Dr. Sam Paleo.
Sam Paleo, wonderful guy.
Oh, yeah. I had him on the show, and he did the whole thing about how my hip, the whole bit,
Oh, he does a great job.
Yeah. And then, go ahead.
So I went to high school, Plymouth Whitemarsh, then went to Penn State, and then went to the Philadelphia College of Osteopathic Medicine.
Where's that?
Down in Philadelphia on City Line Avenue.
Okay.
And been in practice ever since that.
And how about family? You got the one son?
I have a second son who went to LaSalle High School and then went to Loyola College, and he works in finance now. And then my daughter...
Well, you got to count the money as you make it, right?
We don't make that much anymore, but hopefully he'll be counting a lot.
Yeah.
And I have a daughter who graduated from Villanova, works for a company in West Conshohocken named...
What's her name?
Colleen.
Colleen. That's a typical Italian name.
Yeah.
Now, I mean Irish. I'm saying, when Irish eyes are smiling. You look typical Irish.
Yeah.
But St. Patrick's Day, I'm going to bring you back.
But my wife's Italian.
Oh, Madonna. Yeah. What part of Italy?
Sicily, I hope. Well, no, not Sicily. Her last name's Lario, and I think I'm not sure where.
Campania.
No.
Rome.
Well, there's sections up in North Italy.
Yeah. Well, they
have
got
a lot
Venice,
of Lario and.
Well, the next time you come back, find out what town, the name of the town.
But my daughter is going to go to graduate school for an MBA in Milan.
Oh,
Milan, Italy.
I was in Milan. Oh my God.
I've never been there, but.
Yeah. Oh yeah. Tell her when she goes there, the piazza. And all them pigeons. You got a bob and weave. Got a bob and weave.
I'll warn her.
Yeah. And so she's going to go to Milan.
She's going to Milan.
Dr. Blasco's son, he's directs music and all. His son lives in I think it's Milan. I think he lives in Milan. And then he does a concert in Russia too.
Okay.
Yeah. So
Dr. Blasco is a good friend, and he's a terrific cardiologist.
Oh yeah, he's my man. He's got to put he put the pacemaker over here. Well, he didn't put it in there. He's the one that recommended. I had one over here, and then something was happening. It wasn't working right. I got an infection or something. They took it out, put it over here, and then went over to Lacanau. But
well, you've got the best with Dr. Blasco.
Oh yeah, he's a great guy. Yeah. Great guy.
You know, Hank, we are really fortunate in this area. We have a lot of good doctors, a lot of good specialists.
That's right. That's right.
As a family doctor, we have to call on them once in a while. And we are really blessed with many, many great specialists out here.
Right, right. Well, there's now on Riverview Hospital, that was up there, and I remember my wife and I, well, we were down Chinatown, we were eating, and she said she was hungry for Chinese food, so they closed at 2 in the morning. I was a policeman, I got finished work at midnight,
Right.
so we shot down there. While she was eating Chinese food, she says, "Ooh," I made it over to Riverview Hospital,
Riverview,
and she had the
yeah.
Bambino, you know.
Yeah.
But this, one thing about Mercy Suburban, you go there, I like it when you walk in there, it's like open, and there's somebody that greets you, and there's parking,
Yeah.
you know. I don't want to knock another hospital, but like and all, I mean, you have to be an engineer, and you have to be I don't know, to find a parking lot, and then to find where you got to go. Just parking lot A, B, C, D. You know, by the time you get there, you're dead.
Yeah.
If you're just sick, you know. But
Well, you
no,
know,
that's what I like about that. It's,
Yeah.
and one thing about when you come into the local hospital, somebody comes over to help you out. Well, where you from? Oh, I'm from Norristown. But you know, when you go to these other hospitals way out, you're nothing but a number.
Yeah.
Nobody knows you, you know. I mean, they care for you and all, but it's nothing like saying, "Oh, you're from Norristown? Yeah, I used to live. I live on." That means a lot. I think it helps you.
I agree with you. You know, when we need a place like Lankinola or Penn or Jefferson, that's great. But a lot of care can be done locally, and I agree with you that it is a nicer feeling.
Yeah, right. Good. So now, what is now when that cancer opens up, that new addition?
Yes.
What all's going to be involved there?
Well, it's a big project. I think a lot of it is housing the newest equipment.
Right.
And that's probably the biggest thing. Although things like genetic counseling and pleasant rooms for the chemotherapy, that type of thing will be very helpful. You know, people come in, they want to talk about what cancers are in their family, and is there a possibility they're going to get the cancer, or what is their risk?
Yeah.
So I think that'll be a valuable thing to the community.
Well, you as a family physician, people come in for different reasons, right?
Sure.
You're almost like a psychiatrist, just about everything, right? That goes with it.
Yes,
No?
we
Tell me some interesting things that people should be on the lookout for, or for their own health.
Yeah. Well, you know, there's certain screening tests that we recommend and we like to do. Certain things like a mammogram.
Okay.
It really upsets me to have patients and such who don't want to get a mammogram. We try and talk them into it. We tell them about it, but some still don't want to get it. But we're doing a better job, and people are getting mammograms.
What is it? The fear?
It's the fear. Sometimes people just don't want to find something, you know, and they're
yeah.
afraid of what they're going to find. They think, well, let's leave well enough alone. But
Yeah.
but you try with cancer to find it early. You don't want to leave well enough alone. You want to
Yeah.
find it early and see if you can how
Well,
you can help.
I have to use-
Colonoscopy. Now, colonoscopy is very, very effective.
Yeah.
And we know that if you follow your schedule with getting colonoscopy, that we can cut down colon cancer. But that's a little bit more rigorous test, the preparation for the
Yeah.
test and such. But you know, I've had
Preparation
three
is
of them.
worse
Preparation's
than the thing. I don't, you know, not on.
Yeah.
You got up the day before. You don't go nowhere. You're one place over there.
But you know, Hank, as I've gotten a little older, I've had 3 colonoscopies.
I had about
They're not
3
so
too.
bad. They're not
Huh?
so bad, and they certainly are worth it if they save your life.
Oh yeah, oh yeah. Like the last one I had, and you're all psyched up and everything, and they wheeled me in there, and and then I don't remember anything. I don't remember they put anything on my. Next thing you know, I'm in a recovery room.
Right.
It's over. It's
over.
over.
Yeah.
I said, "What do you mean it's over? What happened? You know?"
Yeah.
So
And we have some good doctors out in this area who do that very, very well.
right. Now, how many? They have doctors coming from all over. I remember there for a while at Montgomery Hospital because I used to drive the emergency wagon, the police. I used to know all the doctors and nurses, and I knew most of these doctors when they were just interns. They came there, you know. So they They took that the training. Remember, it used to be like 2, 3 o'clock in the morning. They would half of them were what they call them, interns.
Interns and residents.
Right, right.
Yeah.
And we had to wake them up. When you have an accident, 3, 4 o'clock in the morning and all. Do they still do that? Is that part of an intern thing?
Doctors, when I trained, doctors worked 100 hours a week.
What's that?
I say when I trained, doctors would train about 100 hours a week. You would work as an intern, resident.
All right.
Now the surgeons would work more than that. Some of them would be 110, 120 hours a week.
Oh.
In fact, I used to try and figure how many hours are there left over. There's not many.
They make them work different hours of the day. Is that part of the training?
That's part of the training.
Be part of ready for an emergency.
Yes. Plus, but now the hours have gone down. There's a maximum now of 80 hours. The training doctors cannot work more than 80 hours a week.
Oh.
And that was because they just felt they were just too tired. They weren't learning that much, and they want to make sure that the patients are safe.
Right.
You may not want to see a doctor who's been up for 30 hours.
Yeah.
So they have made changes in that, but they still work darn hard. They still work 80 hours a week.
Yeah. Because I remember a couple of times there, we come in with an accident, and they had to call them, and the guy come down sleepy-eyed. What was it? Whoa, I'm just wondering, what's scoop
And
is.
Hank, the training period is very, very long. I had a student who was in my office. I was teaching about family practice, but he really wanted to become a heart surgeon. So he got into the heart surgery program. So he went to 4 years of college, 4 years of medical school, and his program for heart surgery is 8 years. So it's 8 years after all that. So these kids are really dedicated, and they really work hard to get there.
So when the doctor sends you the bill, don't complain, because look, this guy knocked himself out. He deprived himself of a lot of things getting his education. I don't mind that as long as he, But you know what I'm happy about? I'm happy that the Suburban Hospital, Mercy Suburban, is growing. You say, well, just stay in there, nothing's happened, but it's growing. And it's a good sign.
It's a good sign, and they've put a lot of money into the place, brought in some expert doctors when we needed them in certain areas, and they really have progressed just tremendously.
Well, what do you do? Do you to get new doctors in there? How do you do that? They apply? How's that work?
Well,
I just wonder how doctors get in certain hospitals.
They may just apply, but in some cases they're recruited. In some cases, the hospital or various doctor groups
hear
will
about
go
them.
out, and they'll say, we need another doctor. We're going to search for another doctor, and that generally is the way it works now.
Yeah, Dr. Belasco, he recommended when he thought that the infection was going to go to my heart, back of the pacemaker, and he called. He said, "There's one doctor that does his specials, Dr. Ferdinand, down in Lacanau, So he called him, and they got me down there pretty fast, and. But it was good, and I have great friends with Dr. Ferdinand. Yeah, we had lunch and all. He came to the Mayor Rizzo's memorial thing I have every year, So,
another thing that Mercy Suburban has done, they've hooked up with Jefferson, and they actually have a robot in the emergency room for patients who have had strokes, and they've become a stroke center, a certified stroke center. So if you go there, you're going to get the latest treatment, and this robot comes. It's like a TV camera and can examine you.
We don't have a picture of that, do we?
We don't have a picture of that, but the information goes right down to the doctors at Jefferson. And if you can be treated at Mercy Suburban, they'll treat you there. But if you need to be taken to Jefferson, they'll fly you down. Sometimes complicated things they can do. But now they can give clot-busting drugs for strokes to try and break up the clot. There's ways they can retrieve the clot.
Wait, run that by
sometimes.
me again now.
There are drugs that they can give, just like they have done for the heart for a long time, but now we can do it with the brain. And if an artery is clogged up, and that's why you're having your stroke, they can give you a drug to break that clot up before the damage becomes permanent.
Yeah.
And at some of the very sophisticated places, they can actually go in with instruments and retrieve that clot and bring that clot out.
Get it out of there.
Yeah, so that has been a great thing. The other thing that Mercy's proud of, and I don't blame them, there's a thing called the Joint Commission. The Joint Commission is a medical group that certifies and examines programs all over the country. Every hospital is in this. And Mercy Suburban, they looked at how do they treat heart attacks, how they treat heart failure, pneumonia, asthma, and 1 or 2 other things. And Mercy Suburban was in the top 400 of all the hospitals in the country, and there must be 8,000 or 10,000 hospitals in the country. So they were very proud. They worked really hard on that. And that's a real feather in their cap.
Yeah, you know, that's what I read that there was an expansion after the expansion. But I was just looking at expansion. What's going in that what's going in that building? You know, that is great. You know, because I remember the advancement from between 8 years, my hip replacement, the first one I had, and then 8 years later I had the other one replaced.
Use a little different device.
Oh yeah, well the same doctor, you know, but different. I didn't have as much pain. I didn't stay in a hospital any more than 3 days, and I'm out of there.
Right.
I didn't have to, you know, the people didn't have to come to my house for 2 weeks or anything. So, and then I was less pain, and I said to Dr. Paleo, I says, how come I had no pain this time? He says, well, they put something in the intravenous that cut the, you know, little things like that. Like you're talking about, rather than splitting the guy's head open, getting it and you know,
Yes.
pull out,
You do this through the arteries.
Research.
You know, the laparoscopic surgery for like gallbladders you had asked about, it's been around for a while, but I can remember when I was a student going to the hospital and seeing these poor people with their gallbladders taken out. And boy, they were in the hospital for a week or two and suffered. And so since they come up with the laparoscopic technique, I remember having one of my patients go, and she went to a party 2 nights later. So she's a local person. But there's been tremendous advancement.
Oh,
and,
yeah. But, you know, when I drove the emergency wagon, that was first state. I'd be the first one with, you know. And we used to get, now, I remember one thing, like if a burn, we used to put butter in, they don't do that no more, right? You don't put something cold and stop it from cooking.
That's right, exactly.
So there's a lot of changes.
A lot of changes.
So, hey, the half hour's over.
Went quickly.
Hey,
Hank, it was
Doc,
great to meet you. Thanks
thank
for having
you.
me.
Wait, now, ladies and gentlemen, I'm really happy that I was able to put this show on, and Mercy Suburban is on the move. It's there for us. It's there for us to helping us, you know. And he mentioned something about some people don't want to get the, you know, a little checkup. When in doubt, check it out, and you'll appreciate it. You'll enjoy life, okay? So, Doc, let's have a little bit of Allah Zalud in Italian means to your health, right?
You.
Thank you, ladies and gentlemen, for allowing us to come into your home, and I hope that we got something out of this because we're here to help you with this show, whether it's legal, whether it's medical, in any way, and we'll have some music go along with it. So, Glenn Miller, Dr. Glenn Miller, he didn't bring his band with him. Next time, we'll bring the band. Okay, so thank you, Doctor.
Yeah,
right,
thanks,
thank you very much.
It was a pleasure to be here.
Adios. God bless each and every one of you. Thank you.